Okay, this video is called How Disease Happens. I had previously made another version of it, which I thought was pretty tame, but sometimes you say a buzzword or something and then YouTube says, this is PG-18. So this one will be even more gentle. Not that there was anything exciting about the last one. Okay, so this is How Disease Happens, because I'm going to say something. In my opinion, pretty well-informed opinion on the subject, doctors aren't really trained in disease, okay? They memorize a bunch of rare stuff and then they're taught all these standard protocols, but they really don't know pathophysiology. So I'm going to explain to you what actually causes the disease, because the first step to curing a disease is to figure out what causes it and avoid what causes it. So you got to know that. Whereas if you look for the medical book, they're going to tell you for almost every single thing, causes unknown, and there's a reason for that. If you don't know the cause, well, you might as well try their pill. Okay, what they do for just simple diseases like hypertension, obesity, diabetes, coronary artery disease, hypercholesterolemia, they just put you on a pill. You have to take that pill every day the rest of your life. So basically, you're like a cow, and they milk you for money every single day the rest of your life. That's what the typical chump does. And most doctors don't know any better. They mean well. They're just taught, hey, there's really nothing you can do. Follow the standard protocol. Standard textbook will say hypertension, 95% is essential, meaning of unknown cause, idiopathic. The doctor's an idiot and the patient's pathetic. Take our pill, match the ill to the pill, send a bill. Okay? All right, so now I'm going to start showing you what really happens. Okay, one of the key points to understand about disease is, patients usually are very simple-minded. Doctors too. Everybody wants 1 + 1 = 2. That's not how it works. And if you ever want to understand, you have to get what I'm saying here. It's going to be pretty simple, but you need to listen to these concepts. Basically, you hit a tipping point. You accumulate risk factors due to eating or drinking toxins, for example, and they start accumulating in your body. When you're 20 years old, you're full of vigor, lots of physiologic reserve. You can resist the disease. Your immune system is strong enough usually that it can resist most disease, almost no matter what you do. You can stay out drinking until 2 o'clock in the morning, eating pizza, drinking beer, and etc. Okay, but you try doing that when you're 40, it's not going to go so well. Okay, so anyways, people accumulate toxins and fat and other risk factors, so they hit a tipping point and then they get symptomatic in their disease. And you need to pay attention to the symptoms because they're a warning sign. The next time you hit the next tipping point, it could put you into irreversible disease. Like you might first start out with a little chest pain, then the next time it's a heart attack. A heart attack might be a mild one, but it'll also maybe could kill you. Okay, you'll have damage to the spine. You'll have damage to the brain. So you need to get your act together. The faster the better. Also, the older you get, the more fragile you get. So you have to keep on improving your health habits. What was good enough to get by at 20, 30, even 40 is not good enough at 50 or 60. Okay, I can tell you all the patients, they have the same disease. It's almost monotonous. They're all hypertensive, pre-diabetic or diabetic. Those are the gateway diseases causing atherosclerosis. Atherosclerosis plugs up artery in the brain, the heart, the eyes, the spine, and every other part of the body. And things just start going, vision, hearing, etc. Okay, so atherosclerosis is pretty easy to prevent. All you need to do is know a few things, okay? Let me try to shrink myself here. Okay, so we talked about risk factors. We talked about the diseases that kill you. Most people, they all die from the same stuff. Hypertension, diabetes, coronary artery disease, heart attack, myocardial infarction, atrial fibrillation, congestive heart failure, obstructive sleep apnea, stroke, kidney failure, cancer, dementia. All day long, I see these diseases. All day long. And then everybody always wants to talk to me about protein deficiency. I've never seen a single case, okay? Not one, okay? Or they want to talk to me about vitamin B12 deficiency. I've never seen a single case, okay? Anyways, what is atherosclerosis? It's a blood clot, okay? You need to know that. That's going to help you. Atherosclerosis is a blood clot. Because once you understand that concept, anything that causes blood to clot increases your risk of atherosclerosis. So severe dehydration is going to increase your risk. High-fat diet, stick red blood cells together, making the blood thicker, more prothrombotic. That's a risk factor, okay? High sodium makes the platelets more activated, more sticky, more prone to clotting, inhibits endothelial nitric oxide, which also decreases platelet aggregation. So that predisposes you to increased risk of clotting. And a bunch of these little risk factors add up, so you hit a tipping point, okay? You form a clot, you occlude an artery somewhere. Hypertension is pretty simple. Why do you have a blood pressure? To pump blood to the top of your brain, your cerebral cortex. Okay, you have to pump against gravity. All right, so that's why you have a blood pressure. When you eat a high-fat diet, you make the blood thicker. So instead of pumping normal blood like water, you're pumping thick blood like a milkshake. Pressure has to go up. With sodium, you vasoconstrict the arteries, inhibiting endothelial nitric oxide. Now they're vasoconstricted, narrowed, so you got to pump at a higher pressure. That's hypertension. All the books are stupid. The medical books are stupid. I've rewritten all the internal medicine textbooks. They're a joke. They're embarrassment. They're a disgrace, okay? And most internists, I know tons of them, they're too lazy and stupid to even read my books, okay? I'm just telling you, this is a fact. Okay, yeah, I talked to an internal medicine doctor recently. He said, you've rewritten all our books and improved them. It's true. It wasn't very difficult to do. Once you get the game, it's the same game for all the chronic diseases. Cause unknown, take our pill, and then you read the nutrition literature. We cured all these patients, okay? All right, so anyways, you avoid the high-fat diets, you avoid the high-sodium diets, you eat the plant food so you get your potassium and magnesium. They have a vasodilatation effect. Hypertension goes away. Once you've lost the Windkessel effect, the Windkessel effect is the elastic fibers in the ascending thoracic aorta that during diastole, cardiac relaxation, they recoil inward to push the blood up. They can't replace those fibers after 20 years of age. So if you keep being hypertensive for a couple decades, you're going to keep blowing out those fibers. And by the time you hit 40, 45, you've lost Windkessel. You're going to have systolic hypertension a little bit the rest of your life. It'll be harder to reverse. So that's what I meant by you'll get these irreversible damage steps, and you want to get your act turned around as fast as possible so you do less irreversible damage, okay? Diabetes, pretty simple. High-fat diets is the main thing, okay? There's a lot of things that contribute to diabetes as well. Psychological stress, caffeine, sleep deprivation. Those are some of the other ones. I give entire lectures all about all the different. There's a bunch of little minor risk factors. I go through all those in my recent lecture. That's easy to avoid. Tons of people put patients on low-fat diets, reverse diabetes. It happens all the time. Look at Roy Taylor. Every single one of his patients with less than 4 years of type 2 diabetes was able to reverse it. They lose weight. They become less obese. They get rid of the fatty liver by losing the weight. The fat from the liver is the first part to go. All of his patients who lost 30 or more pounds, they all were cured. Let's see, what else? Obesity. Obesity is real common. Most common reasons is they're eating high-fat diets, and they're also eating processed food and oils, okay? The processed foods are full of MSG and high-fructose corn syrup, and they're designed to be hyperpalatable, make you want to eat more, so you overeat them. And then they're also full of estrogenic chemicals like atrazine, for example, which are, estrogenic chemicals are fat storage hormones, so you put on more weight, okay? Estrogen goes up during pregnancy. Mama needs to store that weight, gain weight for the baby. Okay, let's see. And all this stuff, being fat's bad. It's not like you're just fat and you don't look good, nobody wants to have sex with you. It also means you're at increased risk for cognitive decline, decreased cognitive function, arthritis, higher cancer risk. Also, less support system. If nobody wants you in their bed, then you're not going to have a husband or a girlfriend, and you're going to have a decreased social support system. So being attractive isn't just for fun on the weekend. It helps build your social support system. So it matters. Trauma. And there's tons of women who got pretty faces, but they're so fat, men don't want to sleep with them. And all they got to do is lose weight, and they try going on all this Ozempic or all this other crazy stuff. All you got to do is eat low-fat vegan. And the populations where they eat low-fat vegan or close to it, 95%, 100% of them are skinny. There is no such thing as a fat person. It doesn't exist. Okay, the lower the percentage of calories from fat, the skinnier the population is. As Dr. McDougall had said, the fat you eat is the fat you wear. So don't eat fat. White rice, 1% of calories from fat. Sweet potatoes, 1% of calories from fat. Regular potatoes, 1% of calories from fat. Lentils, only 3% of calories from fat. Fruit is very low in fat. I got lots of people tell me, I like fruit, but if I eat too much, I just keep losing weight. Look at all these skinny fruit eaters. Durian Rider, Freely the Banana Girl, and I got all these other raw food vegans, and most of them look pretty skinny. I wouldn't go 100% down that direction, but fruit's good for you, okay? And it does make you skinny. It's very low in fat. It's very low in protein. Okay, next one, trauma. You got to be careful about trauma. A lot of people have had a lot of trauma. Motor vehicle crashes or from sports, for example. And there's other things, of course. EMF, it adds up. It has an excitotoxin effect. And also, a lot of people, I see them putting their cell phone in their front pocket. It's pretty stupid. It'll change your EKG. I've seen cardiologists putting their cell phone in their front pocket. I just laugh at them. I make fun of them. I know some pretty smart cardiologists, AOAs, and I just tease them.
God, you passed your test, but you're a freaking idiot. You wear your cell phone in your front pocket. Don't you read? Are you illiterate? Okay, congenital vulnerabilities. A lot of people, I see it every day, developmentally narrow central spinal canal in their cervical spine, their neck, okay? And that means a small disc herniation or disc osteophyte complex from ischemia, decreased blood flow to the spine with resultant degeneration of the disc, causing bone spurs. It'll cause severe central stenosis, potentially even cord compression. So what I'm saying is you should assume that you have it. Assume that you have bad genetics. And that way you'll be more careful about your health habits and you won't get these complications. So what I'm basically saying is, your one fat friend could, eat a pizza every day and they don't have a spine problem. But you might have a developmentally narrow cervical central spinal canal and get cord compression from, relatively moderate degenerative disc disease. Okay, you could have bilateral persistent fetal posterior communicating arteries in your brain, meaning that the posterior circulation of your brain, let's say your occipital lobes and your upper posterior fossa, is supplied by your anterior circulation. The posterior communicators connect the carotids to the vertebral arteries and the basilar artery. And so what I'm saying is, assume you have it, because these patients are at increased risk for a brainstem stroke and a cerebellar stroke. Assume you have it, so you be more careful about your habits, okay? A lot of people have a ramus intermedius, a third branch coming off the left main coronary artery, the widowmaker coronary artery, okay? And what that means is they're more predisposed to having a heart attack. It's harder to stent them because they got 3 smaller arteries instead of 2 bigger arteries. So assume you have unfavorable anatomy and be careful. Okay, in the countries where they eat low-fat, plant-based diet, they don't have any coronary artery disease. They don't have any hypertension, zero. They don't get type 2 diabetes. These are, BS Western diseases from high-fat diets, okay? And you got to watch out who you listen to on the internet. The big thing on the internet these days is what I call the high-fat phonies. They're basically taking the success of Walter Kempner and John McDougall and then claiming it happened with their high-fat phony diet. And they start telling you, oh, have some soy, super high in fat. Have some flax, super high in fat. Soy and flax are super estrogenic. And then they say, oh, you need your omega-3s, even though they're associated with increased risk of atrial fibrillation, increased risk of prostate cancer, immune suppression. They're routinely lipid peroxidized. People are overdosing on DHA. When I say overdosing, I mean they're getting too much of it, okay? All you need is ALA from low-fat plant foods, okay? What else do they tell you? They tell you to drink olive oil. What a crock of BS that is. It's toxic to your arteries. It also contains a lot of saturated fat, a lot of omega-6 fat that you don't want, okay? And it's an industrial processed food, okay? What else do they tell you? They tell you canola oil, all kinds of nonsense. Eat chocolate, eat seeds, okay? I mean, if you want to go down that path, if you have a low IQ, then go away. You won't like my channel. My channel's for smart people, okay? Smart people who really want to learn. If you're a stupid chump, you can go listen to all that. All these great results were coming from diets that were less than 10%, mostly around 7%, 5% fat. And then people think they're going to get the same results eating 40% of calories from fat. I don't think so, okay? Dr. Esselstyn's diet, low-fat vegan diet, was compared to like an optimized version of the Mediterranean diet in the Lyon study, and he had like 32 times better results. Basically, he says anybody who followed his diet, they never had a recurrent cardiovascular event, in the opinion of Dr. Caldwell Esselstyn, who has the best results in the world for prevention and reversal of coronary artery disease. Why wouldn't you want that? That's the most common cause of death. Okay, what else? Infections. People actually do better nowadays from infections than they used to. It used to be, HIV was a death sentence. And hepatitis B and C, people often had relatively early onset bad outcomes. Nowadays, lots of these patients, they live a long time. I hardly ever see HIV patients nowadays. They do pretty well being managed as outpatients, most of them. And the Hep B, Hep C patients are doing better than they used to. I still see a lot of them going to cirrhosis, but they're doing better than they used to. Okay, lack of dietary fiber. If you lack dietary fiber, you're prone to leaky gut and get all the complications from that, like autoimmune disease, your blood becomes prothrombotic. Dairy causes constipation. Lack of fiber in dairy, that's a good connection there to increase your risk of getting autoimmune disease. The constipation causes abdominal pressure syndrome, increased back pressure because you're constipated. So you got to strain at the stool. Valsalva maneuvers, contract your abdominal muscles when you defecate. Okay, you do that every day. Stomach pops into the chest. That's called a hiatal hernia. It loosens the lower esophageal sphincter. You get gastroesophageal reflux, GERD, GERD, gastroesophageal reflux disease.
get esophagitis, heartburn, discomfort, increased risk of esophageal cancer, can potentially come up higher and give you sinusitis, rot your teeth. Okay, you don't want that. Eventually, in these old people, I see it leading to aspiration, pneumonia, and death. Okay, inguinal hernias, periumbilical hernias, varicose veins in the leg, hemorrhoids in the bottom. Diverticulosis can lead to diverticulitis, can be quite painful. Same patients get lots of gallstones, cholecystitis. I don't see that much acute cholecystitis. Yeah, I see it. They get a lot more appendicitis. Yeah, I see it, but I don't see that. I see appendicitis, once every 2 weeks. Acute cholecystitis, about once every week, once every 2 weeks. I see diabetes, hypertension, obesity, all this other stuff all day long, every day. We talked about how once you got leaky gut, you're predisposed to prothrombotic problems, because then the bacterial endotoxins, LPS from gram negatives, LTA from gram positive, those are bacterial endotoxins. They get into the blood, they're prothrombotic. Also, when you have leaky gut, you got leaky blood-brain barriers, so they get access to the periphery of the brain. The macrophages of the brain, the microglia, they come in there and they go, incoming bacterial endotoxins. We got a meningitis. Release the toxic oxidizing chemicals. So they release them. They go, clear the area, okay? And then they release all these toxic chemicals. That causes collateral damage to the brain cells in that area. So you're basically causing brain damage when you have leaky gut. You don't want that. You do that every day, 40 years, you're stupid, okay? And I can tell you the average patient over 60 in the Western countries is fat, sick, and stupid by 60, if not sooner. They're, they still know how to find their way home, but, they're mentally slow, okay? You need some vigor to turn your life around. If you're fat, sick, and stupid, you're not going to turn yourself around. Most people don't ever get better. That's another big illusion. I went to the doctor for treatment. You went to the doctor for a pill that has a cure rate of 0%, okay? The vegan diet has very high percent of cure rates, very high reduction in morbidity and mortality. That's what you want, okay? I used to think vegans were a bunch of weirdo, hippie, pot-smoking, tie-dye shirt-wearing scumbags, okay? I had zero respect for them. If you asked me when I was a college wrestler, I'm going to go, get those freaking weirdos out of here. I could give a rat's tail about them. And I also could give a rat's tail about animal rights people. In my opinion, most of them are jerks, okay? I'm not impressed by them at all, okay? Don't get me wrong. I know some people feel it in your heart. I'm like, why don't you help some humans, okay? Okay, humans are a lot more important than animals. The same people who talk about, animal rights, I've usually seen them show contempt for humans, so I'm not that impressed by them. And I have a lot of experience in the animal world, okay? I was considering being a wildlife biologist, and I also considered being a veterinarian. And I got a lot of experience dealing with those types, okay? And I'm not impressed by them. A lot of them are a front. They're watermelons, if you understand what that means. Okay, the next thing, toxins. You want to avoid all these toxins, okay? Iron. They put iron in the fortified foods to make that sound good. Fortified with iron. Yeah, they're shaving off little metal fragments into your food. Your gut's not designed to digest fragments of metal shaved off with a sander. That's ridiculous. They should not be doing it to the food. People become iron overloaded. The men in their 20s, women in their postmenopausal by around 60 or so, and then they get all this ferrous redox cycling that causes amyloid clotting of the blood, changes the shape of the fibrinogen, the blood clotting protein, from alpha helix cylindrical to beta pleated sheet flat, and now you get all these little clots, 2 to 200 microns in diameter. Douglas Cal from England, Atherosclerosis pretorius from South Africa, they're the ones that figured this all out. It's bad. You don't want that. You don't want to be iron overload. So I would even, every time I go to get a blood test, I would tell them, take off a couple tubes and discard them, okay? You discard those couple of tubes and, wanted to lower my serum ferritin. And mine initially was kind of high. Now I got it down to like 110 last time I checked, which is pretty good. I want it down to 80. I'm working towards that. Mitochondrial inhibitors, I'm the person who figured that out, okay? I found over 120 of them. They're not in any book. I own like 7 or 8 biochemistry books, and I couldn't find them in any of the books, but then I started digging through the literature, and I found like about 120 of them. What a disaster that is. Most people are routinely exposed to a bunch of them. You should go through my list and avoid all of them that you can. You got to filter your water with reverse osmosis filtration. They predispose to atrial fibrillation, to cancer, the lack of energy, fatigue, etc. SERCA inhibitors, anything smells bad is probably a SERCA inhibitor. Anything that causes type 2 diabetes, insulin resistance is probably going to be a SERCA inhibitor. It correlates with elevations of hemoglobin A1C. EDCs, endocrine disrupting chemicals, I even think of them as being, we mostly care about estrogen disrupting chemicals.
They're obesogenic. They increase risk of infertility. You get more PCOS, polycystic ovary syndrome, associated with infertility, and also not looking your best, so it's hard to attract a mate. Increased hypertension, diabetes, autoimmune disease. They're all bad, okay? And look at all these things, aluminum and fluoride are in tap water. They're toxic to your gonads. Atrazine turns the male frogs into female frogs. These are routinely. This is routinely in tap water. This is routinely in processed food. Atrazine sprayed on the corn. Glyphosate sprayed on the soy routinely. Glyphosate sprayed on 70 other things. Okay? They're even often spraying some of this stuff on grass. So, you go to the golf course, you inhale this crap. MSG it's toxic to your brain, it's toxic to your gonads, it's a toxic substance, and MFG. And there's some people on the internet trying to pretend MSG and MFG are not toxic. That's horse crap. They're doing it, my expectation would be, because there's money in it. These are billion-dollar food industry chemicals, okay? Microplastics. I stopped using Waterpik. Now, I don't even know if it gets microplastics in there, but I wouldn't take that chance. High pressure water going through plastic. I don't like that combination. Water that sits in the container for a while. Bottled water. I won't drink bottled water from a plastic container. A lot of people nowadays, they're such wimps. They think they need a sip of water after they do one set at the weight club. I can tell you, back in 1970, they would run the entire marathon without one sip of water, okay? I was a college wrestler. We'd have entire wrestling practice, sweat off 5 or 10 pounds, every single practice. We didn't drink water until after practice, okay? We were fine. You don't need to drink water every 5 seconds, okay? It's like a prop, going to the health club. I got my towel, I got my water bottle. Oh, gee, you're such an athlete. Okay, VOCs, volatile organic chemicals, aerosolized stuff. The worst is things that change from liquid to a solid, and solid to a liquid, solid to a gas. They are associated with increased incidence of autoimmune disease and circuit inhibition. So anyways, this is the idea of a tipping point. You hit a tipping point, you get the disease. I'm going to show you one more slide here. And this comes from the movie Colors with Robert Duvall was the older police guy, and then the younger one was Sean Penn. And he was trying to get Sean Penn to kind of calm down and use his brain rather than his muscles a little bit. And so what he says to him, he says, the two bulls are up on the hill, and they see all the cows down there. So the young bull says, "Hey, look at all those cows down there. Why don't we run down there and screw one of them?" The old bull says, "Why don't we walk down there and screw all of them?" And so what I'm trying to say by this is, when you have a disease, first ask yourself, what category of disease is it? What seems to cause it? What can be done to minimize it? And what I'm saying here is, if you go low-fat vegan, close to vegan, you'll reverse many of these diseases. You'll prevent coronary artery disease progression, maybe even reverse it. If you still have intact pancreatic beta cell function, you'll probably reverse your type 2 diabetes. If your hypertension is not that bad, and if you got a little wind castle left, your arteries aren't all calcified, you got a good chance to return to normal, or at least close to it. A lot of other symptoms dramatically diminish. Why wouldn't you want that? Okay, I'm 63. I don't have any of these Western diseases. I got old sports injuries. Okay, but I don't have any of these Western diseases. This is what you can do to avoid them. If there was some other way, I would try to find out about it. I got friends in every field. I could take any supplement. I could take any pill. I could do whatever I want. I don't take anything. I take B12, the most least amount. I haven't even taken it in like 2 months, and I take the most minimal amount because I'm not even sure it's real. But that's the only thing I take. That's a topic for another day. But anyways, this is how diseases happen. You hit a tipping point, you initially get symptoms, then you get minor irreversible stuff, then you keep on getting worse irreversible stuff, and eventually you're screwed. So to prevent that from happening, just optimize your diet and lifestyle. Get your exercise, get your sleep, walk on a treadmill. Pretty easy to do that. You can read, so you get something double benefit out of that time, and it'll make you sleep better. I call the treadmill a sleep machine. I've given tons of lectures on a vegan diet. If you're new to this, check out my video on how to start a vegan diet, and anyways, hope you found that helpful.